Did you know that diabetes can lead to severe complications if not managed properly? Diabetes foot and complications. It's a sobering fact, but one that emphasizes the importance of understanding this prevalent disease. Diabetes is a condition that impairs the body's ability to process blood glucose, commonly known as blood sugar. It can lead to a host of complications, affecting everything from your heart to your kidneys and even your eyesight. Among these complications, one stands out for its common occurrence and severe consequences if left unchecked: the diabetic foot. This is a condition that results from a combination of poor circulation and nerve damage in the foot, often leading to ulcers and, in severe cases, amputations. As daunting as it may sound, knowledge is power. By understanding what diabetic foot is, recognizing its symptoms early on, and knowing how to prevent and treat it, we can significantly reduce its impact. So, let's delve deeper and understand what exactly is a diabetic foot. A diabetic foot is a foot that has a wound or infection, often associated with diabetes complications. And when we say diabetic foot, we're referring to a condition that develops as a result of prolonged high blood sugar levels, a common issue for individuals with diabetes. Over time, these high sugar levels can cause nerve damage, known as neuropathy, which can lead to loss of sensation in the feet. This means that minor cuts and blisters may go unnoticed, allowing them to worsen and become infected. Poor blood circulation is another contributing factor. With less blood flow to the feet, the body's ability to heal these wounds is significantly reduced. In some cases, foot deformities can also arise as a result of neuropathy, creating pressure points in the foot that are more prone to ulcers. So a diabetic foot is not just a foot belonging to a person with diabetes. It's a serious condition with complex causes. Now that we understand what a diabetic foot is, it's time to look at the symptoms. It's crucial to recognize the symptoms of a diabetic foot early to prevent further complications. Now let's delve into the telltale signs of this condition. One of the most common symptoms is a loss of sensation or numbness in the foot. This can often be accompanied by a tingling feeling somewhat akin to pins and needles. The sensation, or rather the lack of it, can make it difficult to feel pain, heat, or cold. Another symptom that may raise a red flag is persistent pain in the foot. This discomfort can range from a dull ache to a sharp stabbing pain. Additionally, you might notice changes in the skin of your foot. It could become discolored, turning red, blue, or even black. Perhaps one of the most concerning symptoms is the development of foot ulcers. These are open sores that don't heal or keep returning. And if you're wondering how to prevent or treat a diabetic foot, stay tuned. Preventing a diabetic foot begins with good diabetes management. The journey to maintaining healthy feet in the face of diabetes starts with one vital thing: controlling your blood sugar levels. Keeping these levels in check is the cornerstone of diabetes management, as high blood sugar can damage nerves and lead to poor blood circulation, especially in your feet. This can leave you vulnerable to foot problems. Regular foot inspection is another crucial preventive measure. It's important to check your feet every day for cuts, blisters, sores, swelling, redness, or nail problems. These can be early signs of foot complications. Don't forget to look between your toes. Next up in our preventive arsenal is the right footwear. Your shoes should be comfortable and well-fitted, protecting your feet while providing them with ample support. Avoid shoes that are tight or rub against your feet, as this can lead to blisters and sores. And remember, never walk barefoot. Even at home, it's a good idea to wear soft, cushioned slippers to protect your feet from injury. Timely medical checkups are the fourth pillar of prevention. Regular visits to your healthcare provider allow for early detection of foot problems, which can be treated promptly before they escalate into something more serious. Now, what if, despite your best efforts, you end up with a diabetic foot? Well, the treatment approach will largely depend on the severity of the condition. Mild infections may be treated with antibiotics, while wound care might involve cleaning and dressing the affected area. For more severe cases, surgery might be necessary to remove dead tissue, or even amputate the foot or part of the leg. Though it may sound daunting, it's important to remember that many diabetic foot problems can be prevented or managed effectively with the right care and treatment. But remember, diabetic foot is just one of the many complications of diabetes. This is why managing your diabetes effectively, keeping your blood sugar levels in check, and taking good care of your feet is so crucial to your overall health. Diabetes, if not controlled, can lead to a myriad of other complications. While we've focused on diabetic foot, it's crucial to remember that this is just one of the many possible complications of diabetes. The high blood sugar levels that characterize diabetes can have wide-ranging effects on the body, affecting everything from your heart to your eyes. Let's start with heart disease. People with diabetes are at a significantly increased risk of developing heart diseases. This is because high blood sugar can damage blood vessels and the nerves that control your heart and blood vessels. The longer you have diabetes, the higher the chances that you will have heart disease. Moving on, we have kidney damage, or nephropathy. The kidneys contain millions of tiny blood vessel clusters that filter waste from your blood. Diabetes can damage this delicate filtering system, leading to severe kidney damage or even kidney failure. Next up are eye complications. Diabetes can lead to various eye problems, potentially even blindness. The most common issues include diabetic retinopathy, which damages the blood vessels in the retina, and glaucoma, an increase in fluid pressure inside the eye that can lead to optic nerve damage and vision loss. And then there's nerve damage elsewhere in the body. This is known as peripheral neuropathy. High sugar levels can injure the walls of the tiny blood vessels that nourish your nerves, especially in the legs. This can cause tingling, numbness, burning, or pain that usually begins at the tips of the toes or fingers and gradually spreads upward. All these complications sound scary, don't they? But remember, they're not inevitable. With careful diabetes management and regular screenings, you can prevent or manage these conditions. That's why it's so important to manage diabetes effectively. Because when you manage your diabetes, you're not just preventing diabetic foot. You're also protecting your heart, your kidneys, your eyes, and your nerves. So keep up the good fight, and remember that your health is in your hands. In this video, we've covered a lot of ground about diabetes and its complications. We began by unpacking the concept of a diabetic foot, a common complication of diabetes, which can lead to serious health problems if not managed effectively. We delved into its symptoms, which include loss of sensation, changes in foot shape, and slow healing of foot injuries. Next, we explored preventative measures and treatment options. Good foot care habits, regular checkups, and staying on top of your blood sugar levels are all essential. If you do develop a diabetic foot, early intervention with appropriate treatment can make all the difference. We also discussed other potential complications of diabetes, such as heart disease, kidney damage, and vision problems. Each of these complications underscores the importance of effective diabetes management. Always bear in mind that effective diabetes management is essential for averting complications. Maintain a balanced diet, hydrate adequately, engage in regular exercise, and stay well informed. Prioritize your health for a healthier future. We kindly encourage you to subscribe to our YouTube channel, like and share this video to contribute to raising awareness about diabetes complications. Your support will greatly assist in educating the public on this important topic. Thank you.